There is a plethora of social welfare services throughout the United States, all that are national, state, and some are even just local levels. But I believe policies that need a dire change is our food and Section 8 housing. I believe the food policies for social welfare need to be reevaluated because there are families in need of resources that are not getting everything that they need. Because there are some times where a family with two working parents may have 3 or 4 children in their home, and their access to food stamps and other food related public assistance resources are limited because of the paychecks that they come in. But due to the bills coming through the home and just regular upkeep on their homes and taking care of their children, they struggle to make ends meet with barely anything given to them from the government. These are people that I believe are in true need of those services and are sometimes held back from them. Also, the Section 8 housing. Rent and mortgages are extremely expensive, and in today's age, it is sometimes very hard to find something affordable. Although there are things that go through a system, they send your payroll through, and you may be eligible for something. Even if you're eligible to pay so much a month, what does that leave somebody extra in order to feed, clothe, and just keep up with that home, buying cleaning supplies and different things? The systems that come up with mortgage and rent payments do not take into account for miscellaneous. They take into account for straightforward bills that you are paying versus what's coming in every month. And I believe that is wrong. I think that there should be a system based on how many children you have and also miscellaneous. There should be a column to fill out for that kind of money that you're spending, which is necessary. The childhood obesity is a big problem in our country, but kids who are a part of organizational sports, that's an expense the parents have to put forward. Therefore, parents who are putting forward money for their children to be physically active and involved in these group activities are then downfalled because that's not considered one of their needed expenses when trying to apply for public assistance for food or even Section 8 housing. I believe that these programs need to have a reform on all levels, state, national, and global. On the state level, that's concrete. That'll say what can be done here specifically. And in Pennsylvania, I think there should be stricter rules to follow when you are able to get these food and Section 8 housing policies. I do know that there is recently legislature going through in order to reform this somehow, and I'm unsure whether or not these laws are passed, but I am for drug testing as a part of these public assistance programs. I do believe that people who are in true need of these resources should not have the extra money available to buy drugs and let alone use them. I think that the money coming in should be used in ways which are helping sustain life, not downfalling your life. And therefore, I'm not sure what Pennsylvania has done. I do know that I read that this was a legislature that was going through the process of possibly being made into a bill or going to the governor, and I don't know whether this was passed or whether it was put aside. I'm not sure if this is also just a state issue or whether this is a national policy that may be put into an effect because public assistance is a national thing, such as the Help for Needy Families. That was a service put forward nationally that every state people are eligible for just for being an American citizen. I think globally that food as a social welfare policy, the food resources, such as how here in the United States we have food stamps like the access cards, I think that the epidemic of children starving in third world countries is definitely a global issue that needs to be put at the forefront. I understand there are political issues that some people may think are more important, but I do believe that the health and well-being of children and all people is ultimately what is most important. And as social workers, one of the main values of our profession is the dignity and worth of people. And in order to help sustain the dignity and worth of people, we should help them sustain and live healthy lives. So I do believe that the social welfare policy that is at the top of my list as being most dire and needing reformed, specifically globally, is food resources.